As the COVID-19 pandemic overwhelms health systems across the world, treatment for other diseases is waning. Asthma, a condition where airwaves narrow and swell, is one of such diseases, especially as breathing difficult or is made difficult. Breathing is made difficult. Now, joining me now on Skype from Lagos is a physician, a cardiologist, and chairman, National Polio Plus Committee of Rotary International, Tunji Funsho. It's nice to have you join me this morning. Now, we see that patients of COVID-19 always talk about the issue of difficulty in breathing, and it's the same case with those who have asthma. But talk to us basically, how more complicated is a COVID-19 case for an asthma patient?
I think we should put it in proper context of the fact that asthma is a very prevalent disease in Nigeria. Approximately 6% of Nigerians, both young, and not too young, suffer from asthma. That's about 6%. So we should be aware of that people have been living with asthma long before COVID-19, came along. And it may be because, they have a genetic predisposition to it. But the most important factors, that tend to trigger it's environmental. Either pollution in the environment from noxious gases, or pollution from things as simple as, pollens or mites, in dust. But as related to COVID, infection. Of course, extremes of emotions, extremes of temperatures, either too cold or too hot, emotions, some asthmatics, when they get too excited, they're very happy, it can trigger, their reactions. And what are these reactions? Essentially, is that they are hyperallergic, so they secrete chemicals into the bloodstream that tends to do two things essentially. They make the muscles around the tubes for respiration contract, so the airway becomes narrower. They also increase, the diameter. In other words, they dilate the blood vessels also in those tubes and in parts of the lungs that we call alveoli. Those are the actual sacs where oxygen exchange occurs in the lungs. So as a consequence, there's much less air moving in and out of the lungs because the passage that moves air from the large ones we call bronchi to the much smaller ones that we call bronchioles are constricted. So they're not able to move air in and out. There's a lot of mucus in there. And all you need, is an infection to make it worse. But the infection as a result of the COVID-19 virus is not any different from infection caused by any other viruses or any other bacteria. So we have not, we've been seeing much more cases of asthmatics, being, infected by the COVID-19. And studies have shown that the outcome for patients with asthma who get infected by COVID-19 does not show there's any difference in terms of mortality or severity.
All right. Now, as hospitals and health systems become overwhelmed with the influx of patients for different things at this time, and also with the suspicion in the air with all the anxiety around COVID-19, we hear that some health officials are rejecting and turning back people who may have some certain kind of condition, categorizing some as not too serious. So you go home for now and then come back after some time. How does this, we can understand how the situation can be at the hospital and how overwhelmed health officials will be. But talk to us, what can lead to a situation like that where some people have to be turned back who need medical attention?
I think, first of all, one should try and dispel the belief in some quarters, and it's quite prevalent. I saw that quite a bit in my practice, that people think that asthma is infective. Asthma is not an infectious, disease. You're not likely going to develop asthma because you come in contact with somebody who has asthma. That may be one underlying reason. But it is quite important. The responsibility essentially lies with the patient themselves. They've been living with this thing for a long time. And there are two ways you can prevent yourself from getting to the point where you get an attack. One is to make sure that you avoid your triggers, and triggers will vary from patient to patient. Also, use your preventative drugs. There are medications that you take, either oral tablets or inhalers that you need to use regularly to ensure that you don't, get attacks, frequently. And there are also, medications that you use to abort when the attacks comes, that you use to inhale to make sure that you can open up the airways and reduce your attack. These are very fundamental.
Okay. We have to leave you here now. Thank you so much, Dr. Tunji Funshaw, a cardiologist and chairman, National Polio Plus Committee of Rotary International. Thank you for talking to us on TVC. And joining me now via Skype from Lagos is a physician, a cardiologist, and chairman of the National Polio Plus Committee of the Rotary International, Tunji Funshaw. It's nice to have you join me right now. Let's get into the basics of prevention. Like they say, prevention is better than cure. For anyone who has this condition, how would you, first of all, how do we prevent this from happening? Or is asthma a hereditary condition where you don't have, if you don't have it hereditarily, you can have it? Can you hear me, Dr. Funshaw?
Yes, I can hear you.
Oh, okay. All right. I was asking generally, how can one prevent a situation of having asthma?
Well, the disease itself is essentially an inherited, kind of trait. Though one can develop it, later in life, because of environmental factors. So we cannot actually say we're going to prevent asthma from the point of view that some people genetically are predisposed to it. The challenge generally is that the environmental factors are beyond the control of a sufferer in certain instances. Sometimes, people, are forced to work in environments where the aggravating factors are inescapable. It's like an asthmatic finds themselves in the airport on the tarmac with the fumes from the aircraft, coming out. Of course, there are also issues that have to do with infection, particularly viral infections. Viral infections have been a common trigger for attacks. So as much as possible, people suffering from asthma need to avoid people who have colds and catarrh. And in this particular pandemic, COVID-19 is just another virus, that can cause inflammation, not in the lungs initially, particularly, but in the tubes. And eventually may actually cause infection in the lungs.
All right, for anyone
like
who
COVID-19,
has...
which essentially...
Yeah, Dr. Funshaw, let me ask this. For anyone who already has asthma, what should the person or what should such patients be conscious of in the face of COVID-19?
I think that's a very good and very important question. It's for them to continue doing what they've been advised to do by their physicians. I think the first thing, as much as possible, every asthmatic knows their common triggers, two common triggers. The second thing is to take their regular medication. There are two types of medications that are prescribed for people suffering from asthma. One is the preventative medication, which they take on a daily basis to ensure they prevent themselves having asthma. And the second one are the abortive medications, which help them to abort or to get relief from shortness of breath by helping them dilate the air tube so that they can breathe better. That is vital in COVID-19 era and outside COVID-19 era. And of course, to avoid some of those other irritants that I've discussed, earlier.
All right. Now, as it is, when it comes to managing anyone in this circumstance, how more challenging is it to manage the situation?
Well, it is a little bit more challenging in the sense that, see, when a patient has, an asthmatic attack, the air tubes, gets constricted. It's more difficult to move air in and out. So if they have COVID-19 infection on top of that, getting more oxygen into the lungs becomes more difficult. And that is one of the things that COVID-19 does, infecting the lungs. But now you have tubes that are also obstructed. So they may get more severe infections. But what studies have shown in recent times is that, the mortality, that is the death rate from COVID-19 asthmatic is not any more different from, patients who do not have asthma. I want to stress, though, that it is much more easier and much less expensive to prevent it. In other words, prevent having asthmatic attacks in this era than actually, treating it.
All right. The inhaler for asthma is quite a very popular thing because you see it all around. But are there drugs that can knock it off totally, or that can cure this condition?
Well, asthma is not a curable disease. Sometimes children will outgrow it. In other words, the tendency to be very allergic, to the factors that tend to aggravate it, gradually tend to wane. They have less and less, asthmatic attacks, and as they get into adults, it stops. But it is not a curable disease in the sense that, you give certain drugs and it stops. As long as you're an asthmatic, you're required to take your preventative drug on a regular basis, which can come in form of tablets and inhalers, or take drugs that, if it's coming on. The important advice is as soon as an asthmatic feels the attack coming on, that is the best time to take their drugs and their inhalers. Because at that time, if you're using inhalers, you can get more of the inhalers into your lungs because the tubes are not too narrow as yet. When they get too narrow, it's very, very difficult to now get the inhaler into the appropriate areas in your small air tubes to get the distension that is required to get the relief. So it's very, very vital that they do not ignore those early signs that the attacks are coming on and use their abortive inhalers.
All right. There are so many environmental factors that trigger, at least from what we have read and even from what you say, there are lots of environmental factors that trigger issues of asthma. And COVID-19 has brought some level of, cleanliness to the environment somehow, especially when it comes to atmospheric air. When many factories are shut down, many aviation is shut down, and we have less of fumes, greenhouse gas, and all of that. Now that we're easing out gradually, what would you advise ultimately to keep the environment healthy so that asthma patients can have a healthier breathing experience?
Well, this is a very important aspect, not only for asthma sufferers but also for every member of the population. I think our Ministry of Environment should there are laws that prevent factories and businesses from polluting the air or polluting the waters as a result of what they produce. And I think those laws need to be more and more enforced. The other thing one needs to also ensure for the sake of everyone or for the sake of asthmatics is the wearing of face masks. There's been a lot of discussions about face masks in recent times, but it's also very important that asthmatics who do not have severe asthmatic symptoms also protect themselves by wearing the appropriate face masks. I want to stress the word appropriate.
Okay.
Where possible, they should get the respirator face mask, which is what they call the N95, which protects them from actually taking in either the virus itself or polluted air.
Okay. All right. Thank you so much, Dr. Tunji Funshaw, the Chairman, National Polio Plus Committee of Rotary International. Thank you for talking to us.